Hello, and thank you everyone for joining us for session 3 of Rev Up 2020. I'm Ryan Schonecker, SVP of Sales and Marketing at Revel. Today's panel session is the 1-2 punch of innovation and member experience for health action. So before we jump in, a couple things. If you'd like to ask a question, there's you'll see on the bottom of your screen, 2 things, chat and Q&A. Please use the Q&A feature. We're going to keep an eye on that, and at the end of the session, I'll come back in and go through some of the audience Q&A. We'll leave some time for that. Also, after the panel session, make sure to stick around for Innovation Lab presented by Revel's product manager, Mary Halverson. She's going to talk about member experience strategies through personalization. Today's session will be recorded, and we're going to be posting it out on revupshow.com. That's where you registered for this. Also, as you're exiting today, there's going to be a brief survey. Please fill that out, and there's going to be a drawing for a $100 donation to the charity of your choice. We will be live tweeting today, so make sure to jump in and also use the hashtag RevUp2020. And with that, I'm going to turn it over to today's moderator, Jared Johnson, to introduce us to the panelists.
Thank you, Ryan, and thanks everyone for tuning in. Very excited to have this panel with you today, and I'm just going to move right into introducing our panelists. We've got a really diverse and experienced panel, and I'm really excited to share with you who they are. We've got Sonia Millsom, who's the Chief Growth Officer at Iora Health. We have David Dundee, who's the lead executive for individual products at Arkansas Blue Cross Blue Shield, and Brian Callis, the managing director for digital health and innovation at Accenture Health. And having to think about where the industry is now, when we're talking about this, the title is the 1-2 punch of innovation and member experience. And so clearly we're going to be talking a lot about what we might consider forced innovation, where there was no choice since the beginning of this year to innovate, to incrementally change things and experiment and try new things. And all that has to do with kind of how every different aspect, every different audience involved in the healthcare experience is feeling today. And so that's one place we're going to start is where members are feeling and how their behaviors are changing. So what we'll do is we'll start with one panelist for each question, and then whoever wants to jump in can do so. And any questions, like Ryan said, throw that in the chat feature or in the Q&A feature rather, and we'll have some time to ask those at the end. So with that, I want to get right into this because I'm curious what everyone is seeing about member behaviors. So we'll start with David on this one, and the question is, how have member behaviors changed since the start of the pandemic? And some examples might be, are you seeing enrollment spikes? Are you seeing utilization higher or lower? So how have those things changed since the pandemic started, David?
Yeah, thanks, Jared. And thank you, Ryan. Excited to be here. First, from an enrollment standpoint, honestly, we've surprisingly not seen a demonstrative change. And I think that's observation is shared nationally. I do worry that the disruption and the displacements resulting from the pandemic may come at the end of this year. I think that's a logical prediction. But I think most even still would agree that the enrollments and displacement forecasts from an ESI to individual impact and transition perspective it's much lower than what was initially anticipated. From a behavior change, I don't know if the behavior change that we've seen was by choice or if it was the result of things like state directives. As an example, early on in the pandemic here in Arkansas, we suspended elective services, which I'm sure was the case in most states at a certain time throughout this pandemic. And during that time, we observed then we obviously lifted the suspension of those services, and we actually saw a slower return to kind of normalized utilization. So one thing that allowed us, I think, to return to that normalcy was the proliferation of telehealth, which again was aided by some actions outside of our control at both the federal and the state level. They were reducing some of the barriers that we had in place, and that was definitely a key contributing factor. And also, before this, many providers were not ready to adopt telehealth in lieu of in-person visits. But they did so, like a lot of people and a lot of industry is done out of financial necessity. Our members, of course, we're thankful for that, because our members, of course, needed not only the vended telehealth solutions, but we, of course, need those brick and mortar provider offices to meet the members where they are. And at this point, they were needed to be met virtually. So overall, Jared, we saw in April, and even some in May, and a little bit in late March, we saw definitely some significant reduction in utilization. We are very close now back to where we were pre-COVID, and in some lines of business, we are actually higher than where we were. And we wouldn't have done that if at Arkansas Blue Cross and Blue Shield, like probably most every payer out there, if we didn't do everything we could. And I think everybody in the industry are doing everything they can at this point. We're removing barriers to telehealth, both medical and behavioral and mental health. Like the barriers include, waiving cost sharing for those services, et cetera. We're trying to do everything that we can. One interesting thing is that the early data does show that, or suggest that those barriers do impact utilization. And so that's been something we have theorized, but I think now we have data to support it in a very trusted manner. So before I turn it over to my fellow panelists, I just wanted to talk about one other thing. It's not really a member behavior, but it's a behavior in general, which is the collaboration that we're observing and seeing industry-wide. It's unlike anything that I've ever seen. And I'd be remiss if I didn't point out the great work that our frontline providers have done on behalf of our members, their patients. So I know that sentiment is likely shared from the providers as well. So with that, I'll turn it over to my fellow panelists.
Yeah, no, thanks, David. I think to add, to the question of just how have people's behaviors changed, as a result of COVID-19. I mean, in general, if you look at a macro level, you're seeing a lot of focus of the home kind of being a center of a whole collection of services. As David mentioned, whether it's virtual health being one way where you receive care at home, but also things like food delivery and all these different areas of how can you actually slow the transmission and you make the home as a focal point, just as a way to shelter in place, and that's changed a lot of our behaviors and still is evolving to this day. That's also led to the major adoption of use of technology for people's health and health care, as David mentioned. Prior to COVID-19, you had people's use of digital for their health and health care had reached a majority adoption. So roughly 50% of people across generations were saying they were using some form of technology for their health and health care. But what we started to find is that was stalling. It had reached that point about 2 years ago, but we weren't seeing adoption actually increase. It had reached a stalling point. But out of necessity to slow the transmission of COVID-19, you started to see virtual health and other forms of technology just, accelerate in terms of its use. So some examples of many health systems were stating prior to COVID, we're seeing about 200 visits a week, and that went up to as many as 12,000 visits a week as a way for people to figure out, stay safe, and where they're at in their homes. Now, another big issue that has materialized as well is just, and kind of come front and center, is the importance and need for behavioral health services. So to address both isolation and so forth. This was a great need before COVID, and it's just become increasingly important as people have had to shelter in place.
Hi, everyone. This is Sonia, and I just wanted to again thank Revel Health and also my fellow panelists for the opportunity to be here today. For those who might not know, Iora is a primary care provider. We are value-based and really think about ourselves as high-impact relationship-based care for seniors with 48 practices across the country. And so just to add a little bit of perspective from a patient and a provider perspective, very similar to what David and Brian have emphasized in terms of really seeing reductions in utilization around specialty and hospital care, as we really had to balance the needs between what our patients needed and also what our teams needed. And so really saw a huge shift into virtual. 70% of our visits went to virtual. They've come down a little bit since then, but really balancing the need to be able to touch our patients. We as a provider are very much a trusted voice and resource for our patients at a time of need. And to Brian's point around thinking about the opportunities to deliver tablets to people's homes, and as well as to think about the other aspects of care that they need, making sure that they were getting outreach, and creating, a relationship that we continue, because many seniors have social isolation. And so being able to kind of support that as well, particularly around mental health and other areas. So not too much to add from what we've heard from my fellow panelists here, but I think, again, to David's point, the collaboration has been pretty significant across the industry, and particularly for our care teams that are on the front line, helping, each other as well as our patients throughout this.
Thanks, everyone. I think that leads us into the next topic, which is how are consumers feeling in general? How are members in particular feeling about their health in general? So maybe not just behavior and utilization and enrollment, but just how are they feeling about their health in general? And particularly, what answers and resources are they looking for? So Brian, maybe we could start with you on this one.
Yeah, I think tying back to the other point, I think there's a high amount of anxiety related to people's individual health as well as their health of their friends and family. And making sure that, how are they doing generally in health, but also concern of, is it safe for me to go back and receive care? If I have something, is it okay for me to go in now? And how do we address that? Virtual health and the ability to get some of that care at home is one answer. We also addressed behavioral health and the need to get support to address both that anxiety as well as just general anxiety is another. But there's still broader need to figure out how can we communicate to people that it is safe to go get care, and that it's important not to delay it at this point. And with that, David alluded to this earlier, is we're seeing a lot of collaboration and a lot of non-traditional types of collaboration come to bear to try to help spread the message that it is safe to go back and receive care, and overall to make sure that people are taking care of themselves, as well as taking care of each other and their friends and family. That's also leading to a shift of, this ties back to the virtual health piece, is it's really about omni-channel types experiences are starting to come back, where it isn't just technology or it isn't just in person, but you're starting to see both health systems as well as health plans figure out how do we mix different ways to reach and engage people, whether it's through technology, whether it's through in-person, and blend those to meet people where they're at.
Yeah, just to build on what Brian mentioned, I think, again, people are stressed. I think particularly if you think about seniors, vulnerable populations, individuals that have multiple social determinants of health issues, transportation, food, as well as behavioral health. It has been an incredibly difficult time, and more families also live far away from their loved ones. So, children trying to take care of their parents in different states, virtually, provide for caregiving, all of those things really contribute not just to the underlying, clinical health needs, but, physical and emotional health needs as well. We really saw a pretty amazing, though, resurgence of the ability to connect virtually. And so we have behavioral health built into all of our practices. And those behavioral health specialists were able to help facilitate conversations, again, for people in time of need, but also even across our market. So we were able to have sessions that talked about stress and loneliness and be able to bring our patients, not just in Georgia, but in Georgia and North Carolina together. We also had a variety of just exercise classes. People's, ability to get out of their home and stay physically active was really challenging during this time. So being able to offer things like chair yoga yoga and the ability to stretch, and again, to be able to see their fellow community patient members on the virtual Zoom, and helping them learn how to use technology to enable them not just for, again, their physical or participating in class, but being able to order food online or get other types of services that they need was significant during this time. And so, again, I think it's just a great example of how we have to be thoughtful. Almost 25% of our population also doesn't have Wi-Fi or internet. And so we need to be really careful and thoughtful about how is it that we can provide services to people who don't have access to everything virtually, and really meeting people where they are, which includes, as Brian mentioned, doing lots of services in the home. As I mentioned before, tablet delivery, other aspects in terms of what we can do to ensure that we're reaching people again in their time of need.
Yeah, I don't really think I have much to offer as a panelist. I mean, the first things that came to mind were largely similar to what Sonia and Brian already spoke to. But, again, to echo what they said, the anxiety and fear were and are real. And what I found was interesting was that there was almost, it seemed like a sense of guilt for thinking that if they didn't have COVID or weren't directly impacted by COVID, that their health didn't matter. And that was, I mean, although largely I think an altruistic intention, obviously I think most on this conference can see, what's the problem with that down the road. And so one thing, just as an example of collaboration that we did in Arkansas, is we launched a campaign with our providers that normally might compete against one another. Obviously, sometimes the relationship between providers and payers can be a little tense at times, but largely, even before COVID, collaborative. That collaboration is just gone above and beyond. And so we launched a campaign called Take Arkansas, and the really had two simple goals. It was kind of, just reminding everyone that their healthcare needs do matter now, even if they weren't impacted or are not currently impacted by COVID, right? And then secondly, letting them know that entering the healthcare delivery system is indeed safe. And that's important. Outside of letting them know when a vaccine will be released, I think that was really, really important to communicate.
Yeah, and I think I would add, David, to what you were stating, and Sonia, to what you were mentioning earlier. There really was that important of also that collaboration, as well as the non-clinical factors, part of what you were mentioning, Sonia. And really that comes down to how can you know the individual or the person at such a deep level to know where are those gaps? Is it housing? Is it access to technology so you can have a virtual visit? Is it food? And then in addition to David, like the example that David mentioned of collaboration, we've seen a lot of collaborations to address those non-traditional healthcare, non-healthcare needs as a way to keep people healthy in their homes.
For sure. All great thoughts. And I think even the theme I hear from everyone is just kind of humanizing every part of what's going on right now and asking ourselves what we can do from our organization and from our side of the industry. So that collaboration, I heard that theme again of what you were all just sharing just now. So I like coming back to that part. And the one critical piece of that whole process is the provider. And I think it's in previous discussion with you as a panelist that we've heard the sentiment that you can't focus on the member without focusing on the provider. They are, and as no surprise to anybody, it's an integral part of everything that's going on. So my question next is, what do providers need from us, and how can we provide it to them? Sonia, we can start with you on this one.
Sure. Yeah, I think, first of all, it's been exciting to see how quickly the pace of change, right? When there's crisis, people come together and do the right thing. And so from a provider perspective, I think we think about a couple of different things that we really need to continue. First is payment reform. So ensuring, that we are on a path for value-based care. We're seeing lots of initiatives, obviously from CMS and the move on telehealth and all of those components, but For those of us that, for Iora, we have been on value-based care contracts. And so we had a lot of flexibility to be able to do what was right for our patients and for our teams. But for many of our brothers and sisters in primary care, they didn't have that option. And when you're driving revenue through fee-for-service utilization, it makes it really difficult to make choices in terms of what's the right thing for your patients and for your teams. And so we need to continue on the path to value-based care. And I think we're far along it, but there's a lot of more ways to go across the entire delivery system too, not just in primary care. The second is really thinking about and building on Brian's comments earlier about patients as consumers. People have choices, and we need to make sure that we are really thinking about the patient experience on a consumer basis and ensuring and understanding what are their preferences? Where is it that they want to receive care? Is it in the home? Is it virtually? Is it, in the office? What is their mode of communication preference? Is it through email? Is it through snail mail? Is it, through text? Having a really comprehensive data interface and understanding of our patients as consumers will allow us to take care of them better based on their preferences, and for us to evolve as an industry to be able to meet their needs, again, based on their status in terms of the care that they need. And again, as we've also mentioned, the things that are outside of the four walls of a practice, for sure. It's also those social determinants of health and transportation and food and a variety of other things that people need. And then lastly, I think we need compassion. Our mission is to restore humanity to healthcare, and compassion for our frontline healthcare workers needs to continue. We saw a lot of it through the crisis, but the reality is that many of our teams are making choices every day to put themselves in front of patients that are COVID positive and are putting themselves at risk. And so we need to make sure that they have the right equipment for that. We also need to make sure that we help them. There is a tremendous amount of change going on with even the education system, and many kids going virtually, for the next school year. And so, helping people navigate through the world going forward, and that is incredibly, incredibly important. And there's nobody, the healthcare workers really make trade-offs every day in terms of taking care of their patients and taking care of their families. And so we need to continue to deliver that compassion for those teams so that we can be thoughtful about that and help them, in addition to payment, in addition to thinking about our patients as consumers, to be successful in this new world. Change has to happen, and it has happened, and it needs to continue along that path.
Yeah, I think to add to what Sonia mentioned, and kind of going back to some prior points, both consumers and providers alike, going back to virtual health, discovered that virtual health was more attractive than they imagined. It was a different way of providing care, and there was a lot of unknown, both on the consumer side and on the clinician side. Now, that also required all people, both consumers and providers, to lower their expectations on the quality of service that they're receiving, like how they were trying to do a virtual visit. And that quality will have a negative impact. There's really this need of how do we actually improve workflow integration? How do we embed technology into care models in a different way? How do we make sure that the experience for the clinician is just as good or as strong and easy to use as it is for the consumer, so that that mode, is easy and doesn't, fits within kind of the day-to-day work. That also is, how do we deploy this in a way that ultimately addresses improvements in labor productivity, so we actually can get more with what we have versus making things go down less from there. A key thing too for going back to the consumer side is a big aspect of this was trust, and people really wanted their trusted providers to recommend different use of solutions and tools to help them with their health and healthcare. And that happened in this forced adoption required providers to recommend different uses of technology, different ways of engaging to help people manage their health and healthcare. The real question is, how can we add that so it's a sustainable thing go forward, so that trust extension from the provider to the consumer happens go forward.
Jared, I think the only thing I might be able to add is, as representative of the payer side, it's my job to hear what Sonia and Brian are saying, and I love hearing what they're saying. And I think it's our job to listen, to try to help them. Prior to COVID, I think one of the biggest issues will be from the provider side to the payer side will continue post-COVID, which is, how can we increase the time that they have with their patient and make their documentation requirements less burdensome? They need the revenue stream coming in. Obviously, it needs to be a good financial proposition for them. We want primary care to be rewarded for the great work that they do, just like all the specialties are. And we want to help facilitate that. So from my perspective, listening is number one, and then just trying to figure out how to help them, like Brian mentioned, from a workflow standpoint, not only from the consumer's perspective, but also from the provider's perspective. And however we can help there, I know we're united to try to do so.
Yeah, maybe just one last comment there to build on that is the whole aspect around data is so important for providers to be able to successfully, manage their patient populations, and ensuring that there are easy ways for providers to get real-time data as quickly as possible. You see not just, historical claims data from payers, but also HIEs, variety of information that helps us be successful in what we're doing. And I think, again, not every provider has the resources to be able to invest in those types of data infrastructures. And so I think there's got to be some thought around how do we facilitate that so that there can be more, again, being able to have the payment right, have the technology right, have the patient centricity of it right. The whole technology and integration is an integral part of that. And so I think there's a lot of work to be done there still to help providers across the spectrum be successful.
Yeah, I'd agree and add, Sonia, that's where we've also seen or starting to see this was happening prior to COVID and is again accelerated post, is really that tighter collaboration between care delivery and financing and trying to address interoperability and data needs. How can we come together? How do we change care models? How can we address the reimbursement needs and reimburse things differently to ultimately address all those challenges?
And all of you mentioned virtual visits or telehealth, and I'm curious what else we need to understand about telehealth. This is kind of a catalyst moment that's happening with it right now. What else that we haven't talked about yet is important for us to understand at this point?
I can go first. I think, first of all, I think it's really, you learn quickly, as we did, as we shifted, people's variation in ability to use technology. And so, there's some that are really comfortable clicking on their phone and, getting online with a provider. And even on the provider side, like having best practices of how is it that you interact on a video setting, right? How do you make sure the camera's in a certain way? How are you looking somebody in the eye? How are you getting the information that you need on a vitals perspective in order to have a successful visit and to establish rapport, which is key in understanding what is underlying with the patient, is really challenging. And so I think, we need to help people, both patients and providers, learn through that. I think there's lots of lessons learned and we're growing and we continue to evolve. I think the other piece is that you kind of forget that when you're on a video, you're actually allowing people into your home, right? We're all, David has a virtual background, but the rest of us are in a place that, you're kind of seeing into somebody's, into somebody's home. And again, when you really start to think about these vulnerable populations, being and understanding what's happening in their home, whether it's other people that are around them or the environment that they're in or all those pieces, it actually is it's a window to opportunity to help build that relationship and build trust, back to Brian's point earlier. But it's also, not everybody's comfortable with letting people in your home. And so we have, we still have lots of patients who could do video, but they weren't actually willing to turn it on, right? They just want to be able to have the interaction and see the physician, but or a care team member, but they still were afraid of showing kind of what was happening in the background. So it really requires a lot of trust on both sides to be successful.
Yeah, and I to add to that, I think that a big part of this is what's starting now is this rethink. How do we actually create and deploy these services in a different way? And you're increasingly seeing both health plans and health systems using product design and service design methods of human-centered design that's really trying to understand the qualitative aspects, what's happening in people's homes, what are their behaviors and attitudes, and then how do we design these services differently to make sure that it meets those needs. It ties back to what Sonia was mentioning about knowing the individual, not just clinically, but also just in general in their life, but then meeting them where they're at and making sure you have a service that can meet on those extremes, those that may be more comfortable with technology and those that are not. And how do you actually meet all those different, across that continuum?
The biggest thing that I see from a telehealth perspective, I'm just going to speak to a challenge, is we've talked about trust, but when I think of this acceleration of telehealth, I immediately start worrying about security, right? And so how do we add credibility and trust to that medium of engagement with their trusted provider, and how does that not erode? And sometimes they've already established that trust, right? And they're just adding telehealth to it. But you talk about new relationships with providers. I think that's going to be an interesting thing to overcome, is how do you create that trust for the first time in that only way that you have, and the only way that you've interacted is virtually. The other thing is, we talked about omni points of care and kind of, things like that, which I think is interesting. What I'm worried about right now is there is just a wealth of options for providers to choose from, right? And then for the consumers to be either they have the option to do that, or so I just kind of envision a world where, our it's kind of like choosing a phone or an AT or a carrier. Our patients going to be choosing providers based off the technology that they use. I don't think that that's ever been a consideration, but I think providers are going to have to start thinking about that. And I think we're up to the challenge collectively. And American ingenuity is unlike any other, but it'll be fun times.
Yeah, I think that's a great point, because I think it gets back again to that patient preference and the consumerism aspect, right? People are looking for ease of ability to interact, again, and based on their preference. Some people still want to come face to face to us, right? Because that is their relationship. They want to get out of their homes. They want to feel like they can touch and feel in a way. So balancing that with the virtual aspect of it and creating an unbelievable patient experience, from every aspect of copay collection all the way through to the interaction with the physician and follow-up notes and interaction on a day-to-day basis. Again, much of that we were already doing at Iora, but the level of it is significantly higher. And to your point, customer expectations around what that looks like and our ability to deliver, I think will continue to push the system to be better and better.
Yeah, and it's interesting to both those points. Prior to COVID, we even asked consumers, what did the impact of a digital experience with a provider had? And over 50% stated a bad digital experience could erode their overall trust and experience with a provider and consider them to switch. And on the opposite side, you even had a near majority that were stating a positive experience just increased their overall satisfaction. It was an interesting one that we keep watching. How will that dynamic continue to evolve?
I think that's the key. We're all going to be watching to see how things evolve. And that
we have to evolve it.
That's a good point. It's not just going to happen on its own, and who else is going to do it? Who's got the responsibility to? So really, really good point there, Sonia. When I think about the innovation side, kind of speaking of that, we've talked about the collaborative nature of innovation that's going on. And I'm curious if we can dive into that a little bit to talk about what types of innovative changes you've seen or you've experienced or you have brought to life yourselves or that you're working on in reaction to COVID. So that'd be my question is, what are the most innovative changes you're seeing right now? And Sonia, let's start with you on this one as well.
Yeah, I actually wanted to start with the story because I think that was helpful, just perspective. As we went through, I think historically, if you think about the interactions with providers and their patients are calling when they're sick or they need something. Again, we pride ourselves on being relationship-based and having a holistic perspective on our patients. But we got multiple, outreach from our patients as a result of what happened through COVID, because we were doing our own outreach directly to them. We were focused on ensuring that, again, that they had somebody to touch and feel throughout a time. It was incredibly scary. And so one of the stories that came from our patients is it was actually a handwritten note, which again kind of is coming back in fashion with all of the changes that have taken place. We're talking a lot about technology, but the reality to kind of like acknowledge people in a handwritten note is still there and say, thank you for calling me during COVID. No one, not even my family, was able to reach me and ensure that I was okay. I felt alone and scared, but knowing that Iora and my care team was here for me gave me the strength to carry on when there was a lot of people and uncertainty in the world. I can't wait to see you, and I'm glad that I've been able to see you virtually, but of course miss seeing you in person. And thank you again. I couldn't ask for better care. And so when I think about that, again, it's a lot of consistent themes of what we've talked about today, but really thinking about hey, when you have the ability, when things are different or not what you expect, being able to do direct outreach, understanding where people are, how you have to meet them, and what their preferences are. Secondly, again, continuing, learning about that, right? I think taking the time to really understand what drives patients' behavior and making change in their healthcare. It's kind of been a theme for healthcare, but I think even now, even more so, it's going to continue to advance. And again, being able to address those social determinants of health that are outside of just the actual care and clinical delivery, but the other aspects which really drive people to make choices in their behavior, I think is tremendous. And then lastly, I just can't iterate enough around, payment and being able to have flexibility to be able to see your patients in whatever modality or mean that's their preference, but that also allows us to deliver the best clinical care going forward. So I think there's still lots of opportunity for that ahead.
Yeah, agreed. I think to build off what Sonia mentioned, a couple examples, and we've highlighted some of these throughout, just the collaborations we've seen have been amazing. So how you have a health plan working with food delivery services to help identify people who have needs and bring it to their homes. Identifying people who have social isolation and finding ways to connect them to other humans and connect. There are just so many examples out there. That ultimately has led to a lot of both healthcare financing and care delivery innovations that were starting before COVID, but now are accelerated and being more meaningful. And we're seeing a lot of non-traditional collaborations and people come together to say, okay, what are those new models of providing care that do provide that omni-channel experience and all those touches? How could we finance care differently to meet the needs and address some of the challenges we've seen across access to technology, food, and other forms of health equity? All that I've seen just start to accelerate and really unlocking some powerful, new, meaningful collaborations. And tied to that also is just people's acknowledgement of care providers and all that they're doing on the front lines. So that's helped people's understanding and appreciation for all that care providers do also elevate. So we assume that will just, hopefully continue as these new models emerge.
Yeah, to me, the member experience will always be most impacted by financial alignment. And this isn't just true in healthcare. This is, in my opinion, true in any commerce, right? Sonia already mentioned it. Obviously, Brian has the prospect of having much more alignment is much greater now than it ever was pre-COVID. And not just kind of in select hotspots, but I think it could be shared amongst the majority of the population. Maybe not all of it, but the majority. And the second point of innovation, it can be a challenge, but it can also be something great, is all the changes with interoperability that are coming down the pike. That could really, really accelerate and foster innovation. To finally have a standardized way to communicate for providers' offices, to not be asked to integrate differently 25 different times a year with different consumers of data and vice versa. I really do think has the opportunity to be a game changer. And I want to commend CMS for finally standardizing that and making that possible. So again, exciting times, and look forward to what opportunities spin off of that. I know most of us on the healthcare finance side are really excited about what all we can do from the clinical gaps in care, even from on the ACA side, risk adjustment and things like that. But just bettering the customer experience, and that includes the member and the provider.
So I want to add actually, and go back to a comment David mentioned during one of our preps, because I think this ties to all the points here. And that was, if we go back to what's the most innovative change to member experience that we've all seen. David, you mentioned just that we've seen really humanity come back into healthcare. It's like this has brought the humanity back, both for members and consumers as well as care providers. I just thought it was kind of a good wrap up to a lot of the comments we've all been saying.
Yeah, I think one of the things I would add, though, is I think also because, it's become more challenging in the world that we're in, I think the segmentation of populations is also really helpful, as we go forward, right? So again, if you think about aligning all the incentives and what customers' preference are, it's really hard for physicians who are seeing, a pediatrics, a child who's age 8, and then later seeing, a senior who's age 67, and being able to kind of deliver that experience in a very specific way for the needs of that patient. And family medicine's amazing. So there's nothing, bad about that, but it's just, the opportunity to kind of really segment around population needs and build, delivery systems that support them specifically to their needs. It's again, what we've done at Iora around seniors. But I think more and more of that segmentation for a variety of, customers across the healthcare delivery system and across our world, I think is just an opportunity that's ripe and that allows, again, to really hone in on the needs of the population in a very specific way.
I love it. I love hearing about what's going on, and it also makes me wonder what's going to come. If we look ahead 12 to 18 months, I think this will be kind of my final question for each of you. If there's one other thing in the next 12 to 18 months that you hope we will see with member engagement or member behaviors, what would that be? Anything that we haven't mentioned yet, or anything you want to go deeper on? But what do you hope you'll see in the next 12 to 18 months? David, maybe we can start with you on this one.
Thanks, Jared. With no prep, and I guess you'll get my instinctual kind of response on this, but I think, to me, things that we haven't mentioned, I'm trying to figure it out. Let's see. Probably I can speak to Arkansas, which is, I do think that there is the clinical model that we have in Arkansas. We haven't adapted quite as fast as I would have hoped. Understandably, though, that we haven't. But Sonia was mentioning segmentation of the population, but if you look at the non-Medicare population, which is kind of made up of, we can just call it commercial, but then you've got this ACA population in there, and expanded Medicaid, traditional Medicaid. I just really think that the needs of those subpopulations are different. And what I'd really like to see is extended hours, a more retail type experience for the members that need that. So if I could have one wish from an innovation perspective, it would be that, a true retail experience is made available to those members in my segment that need it here in Arkansas.
Yeah, I think I would add, and this ties to what you were mentioning, David, and what you said earlier, Sonia. I think it's more the scaling of new care model innovations. It's more and that ties to your segmentation. We have seen, Medicare Advantage or Medicare focused, care delivery models. We've seen a couple Medicaid focused care delivery models. I'm starting to see models focusing specific to the needs of LGBTQ plus and so forth. Women's health focused care delivery models all starting to emerge. a lot of these are in pockets in very different regions and aren't necessarily equitably distributed, and because they're still being figured out. So I think the hope would be that we continue to find ways to blend technology plus people together in new ways that can be affordable yet equitable for all those different needs.
I'm going to go a little off in left field here and just say that we need to also focus on education. I think, people's education status is a direct contributor to people's healthcare status. And with everything that's happening, the most vulnerable people are suffering from an education perspective, which will also contribute to help it, suffering from a healthcare perspective going forward. And if we don't quickly tie those things together from an innovation perspective, we will have, more challenges down the road. And so putting those things together in a way that's comprehensive and helps take care of people going forward needs to take place.
Yeah, if I could just try to put a bow on that messy wrapping job I did earlier. I think what ties it all together, kind of going back to Sonia and Brian's point, in order to get there from an innovation perspective, from a new clinical model for these that are currently kind of on the fringe or marginalized from a care delivery perspective, what empowers that innovation in my mind, again, goes back to more value-based compensation. We need to make sure that they have the flexibility to provide, and from a payment perspective, to provide the delivery that their patient population or their patient panel needs. So I just can't emphasize that enough, and I know that's been a recurring theme of the call.
It really has been. I just want to thank all the panelists. I want to thank thank you for all of these insights, for all these observations. The fact that no one knows exactly what the blueprint is for everything moving forward. I think we have a lot of good points to build off of. We've built a solid foundation here, and I know I've gotten a lot out of this. I know everyone who's watched has too. So with that, I'm going to turn it over to Ryan for the Q&A portion.
Thank you. Thank you to all the panelists. And we've had some questions coming in, and I'll try to get through some of them. So Sonia mentioned something around being value-based provider. And we've previously heard a lot about other providers being able to make shifts or trying to make shifts to being value-based. But during COVID, are people in fee-for-service too distracted right now to make transformations?
Currently, no. We're actually seeing it accelerating. So what you started to see you had primary care. That was a challenge. And I would state there still is a big challenge on primary care, specifically independent primary care providers. And you're seeing both health plans responding to try to help with financial sustainability. So that's a very real challenge. And that is something that, to the point of, is that a struggle to make the shift? I think there is a struggle, but you are in the primary care space. But you are seeing a lot of collaborations that have happened with payer health plans and providers to address that, and we'll likely see more of that go forward. If you look at larger integrated health systems that have a lot of hospital-based care, we're seeing many of those maybe that were, it was interesting to think of transformation, now that's moving to important, and realizing, a value-based structure actually can help in situations like we're in. And many of those had been exploring broader change for a while, and that's accelerated a lot of those moves. And I think as things have stabilized a bit in terms of COVID, you're now seeing that action being taken on the system level. But other thoughts?
I would just add, we've gotten so much outreach just directly to us from other providers saying, can you help us? Can you help us understand what are some of the best practices? How do we get there faster? Because the imperative is real. And so yes, they're distracted, but they also understand that they need to do something different in order to have sustainability of their practices. So they're willing to dig in and to work through it.
Next question. Brian mentioned a technology usage ceiling over the past 2 years that then has now ramped back up. Have anybody on the panel seen any examples of things that have been put in place during COVID also reaching a ceiling?
Well, I'll start at least with what we've heard from other health plans and health systems we work with. So we talked about virtual health or technology just accelerating to get really high. In certain states where in-person visits have reopened and you had a lot of adoption, there was some patterns starting to level off where, let's say, virtual health was up near 60, 70% utilization or use, where we saw things start to stabilize around 20, 30%. And now that's pretty impactful, though, when you went from maybe 1 to 5% of video visits versus in person, and now stabilization is now at roughly 30. Still unclear if that's going to be a trend or a pattern nationally, but we have seen it, peak and start to dip and find a new normal. But I'm not sure what anyone else has seen.
I may or may not be addressing the question specifically, but I'll give it a try. When I think of technology ceiling, the first thing that comes to mind is I think some, especially the high utilizers that have significant comorbidities, I think that it would become very fatigued by all of the technological advancements from their various points of care, right? And so that's the ceiling that I worry about, and I kind of alluded to it earlier, that, there can be, they could have 10 different apps on their phone that represent various points of care for them. And that's what I think we got to be careful of. And to me, that's probably the way that we'll hit the ceiling the quickest. And we got to make sure that we address those barriers so that ceiling is much higher than we can imagine.
Have any of your companies leveraged video, not telehealth, to help educate or provide instructions to patients or members proactively about their services or care for themselves?
Yeah, it's actually a great question, because I think we use the word telehealth and I think people immediately are like, that's a visit and it's billed, or, and that's not how we at Iora have used telehealth. So there's obviously the need around clinical care delivery, but we've actually used telehealth and done exactly that. So instructions just to how to use the video. We offer counseling around nutrition and a variety of other things. Health coaches are embedded within our services. And so, and as I mentioned before, behavioral health and all those types of pieces, as well as virtual classes. And again, community, we have our patient ambassador committees where people are able to kind of congregate and talk about what's happening and provide us feedback as well as learn from each other. And so we've absolutely used video beyond just care delivery, but really for that relationship building with our patient community, which is core to the services that we deliver.
Yeah, us too. I mean, we try to keep our blogs, I think the magic number is, and there might be some disagreement, 2.5, 3 minutes. That's really the message. We try to post a lot of those videos. Anytime we can educate our members in that manner, we try to do so.
Yeah, just to add, even prior to COVID too, we've seen a lot of use of things like interactive video to help people understand their benefits. So post-enrollment, do you understand, what did you buy? How can you maximize what you received? And then increasingly just multiple forms of content, whether it's video, text, or voice. And often, like David, you were mentioning, how do you actually be short and brief enough, yet for those who want more, point them to other resources, and trying to find higher frequency, natural language ways of kind of communicating with people.
Great, thanks. I think the last question I'll ask was, have you seen financial collaborations between providers and payers? And I'll add a little bit to it. I'm assuming the question is around the idea that we're hearing a lot of stories about medical loss ratio and payers having surpluses and providers in fee-for-service environments not having enough. Have you seen any creative arrangements or ways that payers have been helping out providers?
Absolutely. Our reimbursements obviously are confidential, so I can't speak to a lot of it, but I can tell you, and this goes back to the collaboration that we've been alluding to. Without those without that type of compromise, and of course we're understanding and we are doing everything we can from a finance side, whether it be trying to advance monies, et cetera. We need to take care of our providers right now. Like we talked about earlier, you can't take care of your members without taking care of your providers. And I know that Arkansas Blue Cross is not alone in doing that. And again, without getting into the details, we have already done many things to try to take care of the providers during this period of time. And I think all of that is what's leads us to this level of, we were always in it together, but anytime we have a crisis like this, I think it really highlights the relationships, and we're just building on that.
Yeah, I would add, we've seen a number of initial, Blue plans specifically, but other health plans working with specifically independent physician practices, trying to help, with tighter collaboration. So one example is Blue Shield of California and their Alteus division, which is working with a number of independent physician practices. You have examples of moving into care delivery. And then you also have collaborations, which, Sonia, I know Iora has a number of collaborations with many health plans throughout the country too, as they're really thinking through next-gen provider networks and intelligent network structures.
Yeah, I would just reiterate, all of our payer partners have been incredibly supportive of thinking through cash flow implications, settlements, other kind of scenarios that help ensure, again, not just us, but, everybody in the industry is being able to support their needs. So there's been a lot of awesome discussion around how to do that. And I think those things will actually, some of them will become permanent, which I think will be really helpful for the industry.
Great. Well, thank you very much to our panelists. Contact information is on the screen here for anybody who'd like to outreach to them directly as well. And thank you, Jared, for moderating today. As I mentioned, and thanks to the audience for joining us as well. As I mentioned, there's going to be coming up next is the Innovation Lab. And so we're going to have Mary Halverson, who's our product manager at Revel, and she's going to be talking about the member experience strategies through personalization to continue the conversation. So with that, I'll turn it over to Mary.
Thanks, Ryan. So as Ryan mentioned, my name's Mary. I'm a product manager here at Revel, and something I think a lot about in my day-to-day life at Revel is member experience. So we're going to talk about that today, and I'm going to hopefully make some connecting points between the great panel discussion we just had and how we think about member experience at Revel. We're going to start with a little bit of trivia. So I'm going to ask you a couple just member engagement questions, and we're going to use the polling function. So feel free to take your best guess at the answers to these questions. So the first question is, which age group is most likely to engage with SMS? Which age group is most likely to engage with text messaging as a channel? Give people a second to get their answers in. All right, we're stabilizing, so I'll finish the poll. And it looks like we've got the winner is consumers under the age of 30. So when it comes to the actual results of this, something that we find pretty regularly in our outreach research is actually older members, members in that kind of 60 to 70-year-old age group. Are most engaged with text messaging as a channel, which is something that some of us are familiar with and some of us are less familiar with. It's not something that's super intuitive. Okay, next question. Which of these characteristics let me launch this quick. Which of these characteristics have we found to really impact a member's messaging preference? And when I say messaging preference, I mean kind of the tone and the content and the message that they want to receive. Which of these characteristics? Give people a second to get their answers in. All right, we had a pretty even split here. So 39% of folks said geography and 31% of folks said gender. So we'll pull up the answer. And those of you who said geography were right. So this is, again, something we find pretty regularly in our outreach research, which is that someone's living situation, whether they're in an urban setting or a rural setting or somewhere in the middle, does tend to have a pretty significant impact on their preference for the type of messaging that they like to receive. So these are just some kind of fun warm-up questions that hopefully help me illustrate the first point I want to make, which is that humans are weird, right? We're all weird, and as are the members and patients that we serve. The things that motivate us and motivate our members might not be the things that we assume. And same with the things that, the barriers that our patients and members that block health actions. So the things that motivate me to do things that are good for me, and the things that get in my way are obviously going to be super different than the person next to me, and might not actually be what you'd assume. And same vein when it comes to member experience. So what shapes a good member experience just looks so different from person to person, as we all know. And as our panelists talked a lot about today. So these facts are why it's just so hard to nail down member experience, and why it's so important to focus on it. And kind of calling back to the conversation today, this is especially difficult and especially important during these times, during COVID. So as you heard all of our panelists talk about, the way people are feeling and the way people are engaging with their health is changing. And so just keeping a focus and being thoughtful about member experience during this pretty changing time is more important than ever. So I'm going to talk to you a little bit about how kind of our customers often work with us around member experience, and just talk about the principles that we instill in our product and the things that we think about every day in our work. And often when customers come to us with member experience needs, it's usually on one of two levels. It's either, Revel, I've got all of these goals for my members and I need so much from them, and I have so many things I need to get from them and need to give to them. And therefore, I'm just like, I'm going to be connecting with them a lot over the course of a given year. And so how do I make sure that I'm really thoughtful about every single touch point I have, and make sure that those touch points are all additive to a great member experience? So that's kind of one level customers often come to us with. And then the other level is a little bit of a level up from that. So it's members, or it's customers who, maybe they're preparing for CAPS, or maybe they're, being proactive in COVID and thinking about member experience, whatever it might be. They come to us and say, we really need help thinking through a large scale strategy for kind of assessing and impacting our member experience. So I'll kind of talk to you about both of those levels and some of the principles that we think about a lot in terms of our product and how we work with customers. So starting at that kind of micro scale, being really thoughtful about every touch point, I'll talk about 3 of the principles that are kind of built into our product and things that we try to instill with the outreach that we do. The first one is around personalization, which we talked about a lot today, right? It goes back to, I think, Sonia, Brian, David, we're all talking about the importance of this, and just like starting to treat members as consumers, and just like really understanding member preferences and honoring those preferences in the way that we engage with them. And personalization can come from so many different places. The panelists today were talking a lot about the mode, right? Like what type of communication are you doing with them? It could be mode, it could be, channel, it could be messaging, it could be tone, whatever it might be, time of day, and just making sure that you're being thoughtful about what different members need. So a couple just like data points to hopefully illustrate this a little bit. So when it comes to channel, right, we find that the majority of members actually need multiple channels to engage. And this is also something that's been interesting for us to monitor during this time, as our panelists mentioned, as the way people engage just looks so different right now. So just having the ability to understand, or at least make your best prediction at member preferences and honor those, is super important. And same when it comes to messaging. We found that having even just catered, personalized content, kind of back to the trivia question, really does make an impact on both outcomes and an experience. So these are just really important things to be thinking about and trying to prioritize in the outreach that we're doing. The second principle we think a lot about is using every opportunity you have, using every outreach you have as an opportunity to learn. So this kind of goes back to, I think Sonia was speaking to it, right? Trying to make sure that you're listening to your members and you're trying to understand their needs, their preferences, their motivators, their barriers to action. For 2 reasons. First of all, it's just such useful data that you can then hopefully go act on. So right, the more you understand what your members' needs and what they prefer, the better you can meet those needs. And second, I think it's just something we found is a good way to, in every outreach, find little ways to make your members and your consumers feel heard and feel understood and feel thought of in that way. So we think about this a lot in our product. So, every time we do outreach with members, we deliberately put in some of that qualitative questioning, which is, you said you're not going to be able to go do this healthy action. Why not? Tell us what's getting in your way, and let's see if we can connect you with some resources to help you close that gap and get you there. So that's something we think about a lot. And then that third principle is just trying to make sure that every time you have a touch point with a member, you're trying to drive a member to act. So for us at Revel, this really comes to life in the way that we design outreach, which is, making sure that at the end of an engagement with a member, they get an action plan. They get a list of things that might be good things for them to go do, and they get a list of personalized resources tied to that action plan. So, based on the way they engaged with us, we offer up, here's based on what you said to us, here's what we think you might want to go do. And I think the principles we try to hold to with that action plan and with other ways of doing this is, number one, just like giving your members a sense of agency, right? Having a plan, being able to go do something. And then also marrying with that a sense of support. So being able to offer up resources as you're driving that agency. So those are some of the principles myself on the product team, and we think about a lot at Revel, at that micro level. And then there's that macro level. So like I said, this is a kind of another instance of customers coming to us with needs around member experience. And often these are customers who, whether it's that they're preparing for CAPS or that maybe they've seen their member experience ratings drop and they're looking to bring them back up. Or maybe, like I said earlier, they're being proactive in COVID, knowing that things are changing so much and they just want to keep a consistent pulse. So they come to us and ask for help with this. And usually the way we frame it with customers is, the way that's familiar to a lot of you, right? Which is this kind of continuous improvement cycle. So getting in a really good habit of measuring member experience and keeping a pulse on it, actually looking at and analyzing the data that comes out of that. And then most importantly, making meaningful connections and intervening and doing that in a continuous cycle to monitor progress over time. So this is kind of how we frame it with our customers. And often how it ends up is, in that kind of measurement portion, often customers are using just a kind of a generalized member experience survey. Some customers, if they're focused specifically on CAPS, are using our pre-CAP survey, whatever it is. We're our team of content and design folks are pretty careful to make sure that we're designing good assessment tools and kind of connecting into that next piece, which is in the data piece. Designing the assessment tools in a way that will actually leave you with a bunch of actionable data. So we're pretty careful to make sure that when we're asking a bunch of questions of members about experience, we're getting at the why with them and we're asking those follow-up questions so that when we get to step 2, we actually have some meaningful data to work with. So step 2 is, like I said, regularly taking those results and actually looking at them and doing something with them. So for us, right, it's stepping back and understanding with customers. We measure member experience. What's the pulse? What's happening right now? What are trends? And then building some hypotheses and strategies around how to intervene, which is kind of leading into that third step, which is trying to regularly, and this is the most important part, right, connecting members with resources based on real information. So whether you heard me talk about the member action plan earlier, right? Sometimes it's right in a member's face as they finish a survey, it's right there. But often we think strategically with customers about, let's take a look at this data and then let's kind of craft some fast follows to connect members with resources where it's actually needed and relevant, and make sure that we're not oversharing resources that aren't useful and we're sharing enough of the resources that are. And this is kind of, I think, the best cases, and the best cases for plans that we've seen is when they're kind of doing it in a continuous cycle, right? Change takes time. And so getting into the habit of measuring, analyzing, intervening is just something that we try to instill. So those are kind of the 2 major points I wanted to drive home. Like I said, I think it's just so important to think about both of these levels, right? We all have needs to get in touch with our consumers, making sure that we're being thoughtful about every outreach, no matter the goal. And then also thinking carefully about when the time is right to step up and to think about when do I start focusing energy on this as like in a strategic way, and kind of adhering to those principles throughout. And so in that spirit, I think something we wanted to offer up to you all as part of this conference is a content assessment. So you just heard me go through some of the principles. I knew I blew through it, but some of the principles we think about a lot at Revel when it comes to member experience and outreach design. You all connect with members all the time, and I'm sure you have a lot of content that you use to engage with those members. So something we want to offer is, whether it's an old piece of content that you want to learn from, or whether it's actually something you're currently acting on, we want to allow you to pass us that information and to give feedback on it. So we're happy to pass it to our teams of people who think about this at Revel, and just give you feedback on that content through this lens, through these principles I just called out. Think about how you might tweak those those messages to bring home member experience a little bit more. So if that's something that interests you or your teams, feel free to drop us a note, revup@revelhealth.com. And yeah, I think that's all I've got. I just want to say thanks again for sticking around and listening. I hope you got something valuable out of this.
Thank you, Mary, and thank you, everybody, all the attendees for joining us today. Thank you to the panelists and to moderator for our session today. I really appreciate it. As Mary mentioned, if you're interested in that content review in the chat, you can copy and paste the email address from there. But also, as you exit today, don't forget to fill out your survey. It's going to be, we're going to do a drawing for a $100 charitable donation to the charity of your choice for those of you who fill it out. Also, as a reminder, there will be a recording of today's session at revupshow.com. We hope to see you all next week for our next panel, which is going to be on social determinants of health up close and personal. Look forward to seeing you all then, and thank you again for joining us this week.